Hello dear nursing aspirants, welcome to Ganesh Nursing Academy. So today I am going to discuss some of the important MCQs on neonatal resuscitation. Okay, so let's start today's session, that is neonatal resuscitation, important MCQs. The first question is, what is the first step in neonatal resuscitation? Option A, provide a positive pressure ventilation. Option B, start chest compression. Option C, dry and stimulate the baby. Option D, intubate the baby. Okay, see here, what are the steps of what are the steps? Okay, what are the steps involved in neonatal resuscitation? The steps involved in neonatal resuscitation is, first one is temperature, maintenance of the temperature. Then what is airway establishment? Then breathing. Then circulation. Okay. So first step is temperature, establishment of temperature. Okay. Maintenance of temperature of the baby. Then next one is airway. Okay, we have to establish the airway. Then breathing. Okay, the breathing of the baby has to be okay. We have to give positive pressure ventilation. Then circulation by the chest compression. So this is a way we are going to maintain the baby. Okay, we are going to do the neonatal resuscitation. Okay, so what is the actually algorithm of this neonatal resuscitation is? So I will tell you the algorithm. I'll just briefly discuss about the algorithm of a neonatal resuscitation. Okay, so what happens here when baby birth? Okay, birth of the baby takes place. Just a second. So when first what happens here, whenever the birth of the baby takes place, after the birth of the baby, okay, if baby cries, okay, and if it has a good muscle tone, okay, if it has good muscle tone and heart rate is more than 100, okay, in that condition no need of any neonatal resuscitation, directly we can shift the baby for the normal newborn care. Okay, newborn care has to be given. Okay, so just we need to give newborn care. But what happens if baby do not cry? If baby do not cry. Okay, if heart rate is less than if heart rate is less than 100. Okay, if there is a poor muscle tone. Okay, so muscle tone is poor. Okay, if muscle tone is poor, in that condition the baby requires a neonatal resuscitation. Okay, and what are the steps involved in neonatal resuscitations? Okay, so I have already told the steps involved in neonatal resuscitation is, first and foremost is we have to maintain the temperature of the newborn. Okay, first is temperature. So I'm telling you the steps here. Steps. So now the baby is not crying. Okay, and there is the poor muscle tone, and the baby is also pale. Okay, it is the pale. So in that condition, first what you have to do, you have to first dry the baby. Okay, dry the baby and stimulate. Okay, it has we have to give stimulation. Okay, so where you have to give, we stimulation can be given at the back rub. Okay, we can do back rub or the sole. Okay, we can rub at the sole of the baby. Okay, and after that, even after back rub and sole, what happens is baby do not cry. Okay, then next one is what you have to do, we have to go for the, this is temperature. Okay, we are drying and maintaining everything. This is temperature. Okay, then the baby do not cry. Okay, and the heart rate is less. Okay, less than 100. In that condition, what you have to do, we have to do suctioning. So here we need to do suctioning. Okay, so suctioning, how we are going to do suctioning? By using a suction catheter. Okay, we have to apply suction pressure, that is 40 mm Hg, and then what you do, you just clear the airway. First you do the suctioning of mouth and then do the suctioning of the nose. After suctioning, the airway will be cleared. Then what you have to do, we have to use a ambu bag and mask. Okay, then we have to give positive pressure ventilation. Okay, so positive pressure ventilation you have. Okay, this is known as PPV, positive pressure ventilation. So that is known as a PPV. Okay, it is known as a positive pressure ventilation. So this positive pressure ventilation is given when the heart rate is less than 100. Okay, when this positive pressure will go, so when the heart rate is, okay, if the heart rate is less than 100, okay, and the baby is still not crying, if still baby is not crying, heart rate is less than 100, then we have to start with the positive pressure ventilation. Okay, and then what we need to do, if still the baby is not crying and heart rate is less than 60. Okay, for example, baby is not crying, so baby is not crying. Okay, So baby is not crying and heart rate is less than 60. When the heart rate is goes less than 60, then we have to go for the chest compression. Okay, we have to go for the chest compression. Okay, that is circulation. Next, what happens here? Even after giving chest compression and what happens? Positive pressure ventilation. If the still heart rate is less than 60, then we have to go for the administration of medication. That is what medication we will administer? Injection epinephrine. Okay, so epinephrine injection should be given. Okay, so these are the steps of neonatal resuscitations. Okay, as soon as baby is received, okay, if baby is not crying, muscle tone is very weak, okay, and if the baby is not pink, if the baby is pale, okay, in that condition, first and foremost, we have to maintain the temperature of the baby by drying the baby, and we need to stimulate. How we can stimulate that? By doing the back rub, and we have to rub at the sole of the baby. And still baby is not crying, okay, then we have to do suction. Okay, airway has to be cleared by secretion, suctioning of the secretion. First mouth and then nose suctioning has to be done. Okay, and then what happens here? We have to check the heart rate of the baby. If the heart rate of the baby is less than 100, okay, and baby is not at all crying, then we have to start with the positive pressure ventilation. Okay, how we are going to start with the positive pressure ventilations? That is ambu bag and mask we have to use, and C and E. Okay, how we can give this positive pressure ventilation? That is C and E method. Okay, C method means we will use a thumb and index finger to just maintain the airway of the baby. Okay, and then see next image I'll show you how to maintain C and E. And then we have to do the head tilt and chin lift. Okay, we have to do head tilt and chin lift, and then positive pressure ventilation has to be given. Okay, so even after giving positive pressure ventilation, if heart rate is okay, heart rate is less than 60, even after positive pressure ventilation, okay, for more than 30 seconds, then what you have to do? We have to go for the chest compressions. Okay, so chest compression we have to begin, and even after the chest compression also, if heart rate is less than 60, okay, with a positive pressure ventilation and a chest compression, even heart rate is less than 60, then we have to go for the administration of epinephrine. So this is all about the steps of a neonatal resuscitation. So now what is the question here? What is the first step in neonatal resuscitation? Okay, so option A, provide a positive pressure ventilation. It is not a first step. Okay, it's not a first step. Start chest compression. Provide a positive pressure ventilation is not a first step. Start chest compression. Chest compression will be circulation. See, that will be later. Then dry and stimulate the baby. So this is the correct answer here. We have to dry and stimulate the baby first. And intubation will do finally when baby is recovered well. Okay, we will successfully resuscitate the baby. Finally, we intubate and we will send the baby to the NICU. Okay, for further management. So answers for this question is option C. The first step in neonatal resuscitation is we have to dry and stimulate the baby to just to initiate the breathe or cry. Okay. So next question we will see. A newborn is apneic. Okay, a newborn after birth it is apneic. The apneic means absence of breath. A newborn is apneic at birth. What is the next best step after initial warming and stimulation? Okay, see how we have done. So the baby has born and baby is now apneic, means not crying here at birth. And first they have done already. What is the next step after initial warming and stimulation? See, they have done warming and stimulation. That's temperature they have maintained by warming, and they also tried with the stimulation. Okay, they have given stimulation, that is by the back rub and a sole. Okay, sole stimulation is rubbing at the sole and the back. So after stimulation, after initial warming, okay, and stimulation, what is the next step they ask? Okay, so next step is option A, start chest compression. Okay, option B, give a oxygen via face mask. Option C, begin with a positive pressure ventilation. Option D, intubate immediately. Okay, so once we do a what is that? After initial warming, okay, drying the baby and stimulation. So next step is we have to take a ambu bag and mask. You can see here, this is a ambu mask and this is ambu bag. Okay, this is ambu bag and ambu mask. We have to tightly seal onto the nose and mouth of the baby. Okay, see, we have to hold like this C shape. Okay, this thumb and index finger we have to use to hold the baby, and rest three fingers. Okay, that is a middle finger and ring finger and little finger we have to go, we use to lift the chin. Okay, so this is a way we are going to do head tilt chin lift, and we are going to give positive pressure ventilation. Okay, so next step after initial warming and stimulation is we have to begin with a positive pressure ventilation. Okay, so positive pressure ventilation we have to start, and intubation it is not done initially, it is done later once successful resuscitation is done. before the baby is shifting to the new NICU, the intubation has to be done. Okay. So next step after the warming and stimulation is we have to begin with the positive pressure ventilation, and we have to continuously monitor the heart rate of the baby. Okay. Next question: the most effective indicator. Okay, the most effective indicator that positive pressure ventilation is working in a neonatal resuscitation is, okay. So when you do a positive pressure ventilation, you can see here we are giving a positive pressure ventilation by ambu bag and mask. Okay, breathe is given. Okay, breathe is given at the rate of 40 breath per minute. Okay, so we are doing a chest compression. So we are giving a positive pressure ventilation. Okay, how we say that the positive pressure ventilation is effective or positive pressure is working? Okay, so the question is same here. The most effective indicator, what is the best indicator of positive pressure ventilation? That is it is working in the neonatal. Okay, in the neonate. Okay, during the neonatal resuscitation. So option A, chest rise. Option B, oxygen saturation. Option C, heart rate is increased. Option D, color of the skin. Okay, so whenever you pause pressure ventilation, the only way you come to know that the positive pressure ventilation is effective is by checking the heart rate of the baby. If the heart rate of the baby, okay, if the heart rate of the baby is increasing, that indicates that your positive pressure ventilation is effective. Okay, so this is the main we need to assess during the positive pressure ventilation, whether heart rate is increasing or not. Okay, if heart rate is suppose the heart rate of the baby is 70, okay, and baby was not crying, and you are begin with the positive pressure ventilation. Okay, when you give positive pressure ventilation, if heart rate increases to 90, okay, or 100, that indicates your positive pressure ventilation is very effective, and you are effectively doing the resuscitation. Okay, if the heart rate is going back, okay, if heart rate is going suppose heart rate is going to 65, okay, 60 or less than 60, even less than 60, that indicates positive pressure ventilation is not helping the baby, and we need to initiate with the chest compressions. Okay, so this is what the question is. Answer for this question is option C, heart rate is increasing. Okay, so the effective indicator that positive pressure ventilation is working in the neonatal resuscitation is heart rate. If the heart rate is increasing, that indicate positive pressure ventilation is effective. Next question: chest compressions are indicated in newborn if heart rate is remain below. Okay, see here, when we do a positive pressure ventilation, we are doing a positive pressure ventilation, okay, for 30 seconds. Even after doing a 30 seconds positive pressure ventilation, if the heart rate of the neonate, if it is goes less than 60, if it is goes less than 60, then we can start with the chest compression. Okay, so chest compression is indicated in a newborn if heart rate remains below, if heart rate goes below 60 per minute. Okay, even after with a positive pressure ventilation, that is 30 seconds. Okay, then we need to do a what is that chest compression we have to start. Okay, what is the recommended compression ventilation ratio in neonatal resuscitation? Okay, so compression ventilation ratio in neonatal resuscitation is option A, 15:2. It is adult, it is done in the adult resuscitation, not in the neonatal. 5:1 is wrong option. 3:1 is a correct option. Okay, so that is 3:1 we need to follow. That is 3 compression. Okay, 3 compression, 3 chest compression. Okay, we need to do 3 chest compression and 1 ventilation. Okay, 1 ventilation. So in 1 minute we need to do 30 compression. We need to do 30 compressions. Okay, and sorry, in 1 minute 90 compressions and 30 ventilation we have to do. Okay, 30 ventilation, and totally in 1 minute there should be 120 events should happen. Okay, 120 events, that is 90 chest compressions and 30 ventilation should happen. Okay, so what is the recommended chest compression and 2 ventilation ratio in neonatal resuscitation? That is 3:2 in a 1 minute. Okay, 3:2 we have to follow. In 1 minute 90 chest compression should be done. Okay, and 30 ventilations, so totally 120 events should be happening during the neonatal resuscitation. Next, the preferred technique for performing chest compression in neonate. Okay, so option A, 2 finger techniques. Option B, one handed encircling techniques. Option C, 2 thumb encircling techniques. Option D, palm compression on the lower sternum. Okay, see, when we do a neonatal resuscitation, that is chest compressions. Okay, so there are 2 techniques we follow, that is 2 finger technique and a uh, thumb 2 thumb encircling the 2 thumb encircling hand techniques. Okay, these 2 are techniques we will use in the neonatal resuscitation, but the most preferred one is 2 hand. Okay, 2 thumb encircling hand techniques. Okay, this is a technique here. Okay, so we are using 2 hands here. You can see 2 hands, so other fingers are encircling the chest and 2 thumbs are placed on the lower 1/3 of the sternum. Okay, and we are giving the chest compression. Okay, and depth of the chest compression should be 1/3 of, okay, 1/3 of interior posterior diameter of chest, 1/3 of interior posterior diameter of the chest we have to give depth, okay, or half inch to 3/4 inch, okay, we have to give depth, okay. So two fingers techniques can also be used, that we can use our index finger and middle finger on the lower 1/3 of the chest, okay. But better than that one, most preferred technique of giving chest compression is two thumb encircling hand technique, okay. You can see here two hands are used here, other fingers are encircled on the chest of the neonate, okay, and two thumbs are placed on the lower 1/3 of the sternum, and two thumbs are simultaneously pressed on the lower 1/3 of the sternum, and how much depth it is pressed, that is 1/3 of the interior posterior diameter of the chest, okay, or half to 3/4 inch of the 3/4 inch depth can be pressed, okay. So answer for this one, the preferred technique for performing chest compression in unit is, it is option C, that is two thumb encircling, two thumbs, okay, and encircling hands techniques, encircling hand technique, this is the correct answer. So let's see next question. Where should chest compression be performed on unit, okay. So they have asked the location of chest compression. Option A, over the lower abdomen, this is wrong option here, we never do a chest compression on the lower abdomen, okay. Next, over the xiphoid process, it's wrong here, just below the nipple line, lower 1/3 of sternum, this is the correct answer here, okay. So this is a sternum, okay, if you consider this is sternum, this is a this part is first half 1/3, okay, this is top 1/3, this is middle 1/3, this is middle 1/3, okay, and this is lower 1/3. So we have to compress on lower 1/3, okay. So we have to compress where, the chest compression should be given on the lower 1/3 of the chest, okay, lower 1/3 of the sternum, here we need to give chest compression, okay. So chest compression of should be given, suppose this is chest, okay, here is the sternum, the lower 1/3 of the sternum, there the chest compression has to be given, okay, and depth should be 1/3 of anterior posterior diameter of the chest, okay. So where should be the chest compression should be performed in the unit, that is just below the nipple line, that is a lower 1/3 of the sternum, there we need to give a chest compression, okay. Option D is what, on the left side of the wall, okay, this is also wrong option here, we should not give on the left chest wall of the baby. Next question, a term baby, okay, born via C-section, that is cesarean section, has a poor muscle tone, not breathing, and heart rate is okay, heart rate is 70 beat per minute. What is the next step after drying and suctioning, okay. So the baby has born here with a lower segment cesarean section, okay, and after the baby birth, what happens, the muscle tone is poor, and it is not at all breathing or not at all crying, and its heart rate is, when you check the heart rate is 70 beat per minute, okay. And what is the next step after drying and suctioning? So we have resealed the baby in the newborn care, okay, we have put the baby in the incubator and we dried it and we do even suctioning. So after drying and suctioning, we just check the heart rate of the baby. If the heart rate of the baby is 70 breath per minute, then immediately what you have to do, we have to start with a uh, positive pressure ventilation, okay. So next step will be positive pressure ventilation. We have to take a bag, ambu bag and a mask we have to take and place it onto the patient nose and mouth, and immediately we have to start with the positive pressure ventilation, okay. And C and E technique, okay. C and E technique is used to hold the ambu bag and this ambu mask, okay, and just to lift the chin and hold the mask tightly over the nose and around the nose and mouth of the baby, okay. So this we have to start with a positive pressure ventilation, okay. So option A, continuous stimulation. Continuous stimulation should not do, okay, only initial stimulation we have to do after drying. Option B, give a supplemental oxygen only. Supplemental oxygen will not help here, we have to give positive pressure ventilation, okay. And begin chest compression. Chest compression is given only when positive pressure ventilation we have started, okay, for 30 seconds. Even after 30 second positive pressure ventilation, if heart rate goes less than 60, if heart rate goes less than 60, okay, beat per minute, okay, less than 60 beats per minute, in that condition, okay, if heart rate goes less than 60 beat per minute, then we have to go for the chest compression, okay. Chest compression is will be done, it is done later, okay, not now at this stage. So option C is the correct answer here, begin with a positive pressure ventilation immediately. Next question, after 30 second of positive pressure ventilation, okay, after 30 second of positive pressure ventilation, heart rate is still less than 60 beat per minute, what is the next step, okay. So we have received the baby, baby is not crying, muscle tone is weak, okay, and we have started with the warming and okay, stimulation also given, okay, and even after positive pressure ventilation, 30 second positive pressure ventilation given, Then we check the heart rate. If heart rate is less than 60 beat per minute, then what is next step? Next step would be option A, continuous post pressure ventilation. It's the wrong option here. Begin chest compression. A. Okay, so this is the correct answer here. We have to begin with the chest compression as soon as the heart rate goes below 60 breath per minute. When we give post pressure ventilation for 30 seconds, even after giving 30 seconds post pressure ventilation, if heart rate goes less than 60, then we have to begin with the chest compressions. Okay, and intubate and reassess, it is done not now at this point of time. Okay, we at this point of time we have to begin with the chest compression. Administer epinephrine. Epinephrine is administered later after chest compression also. If the heart rate is not rising, then the next step would be the administration of epinephrine. So answer for this question is option B, that is a begin with the chest compression. Next question, when is epinephrine is indicated in neonatal resuscitation? Okay, if heart rate is below 100 per minute. Okay, see, when heart rate of the newborn, if it is less than 100 beat per minute, then we have to start with the positive pressure ventilation. Okay, not epinephrine at this stage. Okay, if heart rate is less than 60, after effective positive pressure ventilation and chest compression. Okay, see, when we have given chest compression, we are giving chest compression and even positive pressure ventilation. Even after giving positive pressure ventilation and chest compression also, if heart rate is still, if it is less than 60, then we have to give epinephrine. So option B is the correct answer here. Okay, next option C is at birth if baby is apneic. So if at the birth, if the baby is apneic, directly will not go for the administration of epinephrine. We have to go for the according to algorithm. Okay, not directly will not administer the epinephrine. Okay, if baby is cyanotic, okay, it's not, it's again wrong option here. So answer for this question is, when is epinephrine is indicated in neonatal resuscitation? It is option B, that is if heart rate is remain still less than 60 beat per minute, even after giving positive pressure ventilation and chest compression, we need to start with the what is that, epinephrine injection. Next question, the preferred route of epinephrine administration. Okay, so in which route we need to give epinephrine? Okay, so epinephrine, option A endotracheal tube, option B umbilical vein, option C intraosseous, option D intramuscular. So the preferred route of administration of epinephrine is umbilical vein. Okay, so umbilical vein is a preferred route of administration of epinephrine. Next question, what is the correct dose of administration of epinephrine in neonatal resuscitation? Okay, so what is the correct dose they ask? Okay, what is the correct dose of administration of epinephrine? Okay, so usually epinephrine is available like 1 ampule. Okay, so epinephrine, see here, this is 1 ampule. Okay, so 1 ampule contains 1 ml. Okay, so it is prepared like 1 is to 1000. It is prepared 1 is to 1000, that is 1 ml is equal to 1 mg. It is 1 ml is equal to 1 mg. So now what we have to do, we have to take a 10 ml syringe. Okay, 1 ml we have to take a epinephrine and 9 ml we have to add a saline. Okay, saline or distilled water. So what happens here, it will become 10 ml. So 10 ml is equal to now become 1 mg. In this 10 ml, now we have taken 10 ml syringe, 1 ml we have added epinephrine and 10 ml 9 ml distilled water or saline we have added. Totally become 10 ml, that is equal to 1 mg. Now in this what we'll do, 10 ml equal to 1 mg. Okay, 10 ml equal to 1 mg means 1 ml is equal to how much? It is 0.1 mg. 1 ml equal to 0.1 mg. Okay, so in this one what we'll do, in this only 0.1 ml will take. Okay, in this one what we will take, only 0.1 ml, only 0.1 ml will take, and 9.9 ml again we add a distilled water saline. Okay, so again it become what is 1 ml. So 1 ml is equal to what happened here, 1 ml is equal to point. So again we have just taken no here. Okay, so total become it is 1 ml. So 1 ml equal to 0.01 mg it will become 1 ml equal to 0.01 mg. Now we have to administer how much? We have to administer the recommended dose of administration of epinephrine is 0.01 to 0.03 mg per kg. Okay, if baby weight is suppose 3 kg, okay, then how much we have to administer? That is 0.03 to 0.0, okay, 0.03 to 0.09. Okay, that much mg we can administer to. Okay, so what you have done here, just we have taken 1 ampule. 1 ampule contains 1 ml. So 1 ml is equal to 1 mg. This is epinephrine available, that is it is prepared in the ratio of 1 is to 1000. Okay, so 1 ml is equal to 1 mg. Now what will take, 1 ml of epinephrine will take and 9 ml saline will take. So total become 10 ml. 10 ml is equal to 1 mg we have prepared. Okay, so 10 ml is equal to 1 mg means 1 ml is equal to how much? It is 0.1 mg. So what you have done here, in this one we have taken only 0.1 ml. So okay, so only 0.1 ml we have taken and 9 ml saline we have added. Okay, so total become 1 ml. So 1 ml is equal to how much here? 0.01 mg, because we have diluted this one with multiple. Okay, again with the like only 0.1 ml only I have taken. Okay, 9 ml saline we added, so total volume of solution become 1 ml. Okay, as we have taken only 0.1 ml, so it is how much here? 0.01 ml. So it becomes 0.01 ml. Now 1 ml equal to 0.01 mg. So we have to administer how much? We have to administer like a uh, or like 3 ml or 5 ml, 3 ml we can administer for the baby with a 3 kg. Okay, so what is the correct dose of administration of IV epinephrine in neonatal resuscitation? The answer is 0.01 mg to 0.03 mg per kg body weight. So option A is correct answer. So with this last question also is there one more. After successful resuscitation, what is the most appropriate next step? Okay, discharge the baby immediately. This is not done. Okay, so continuous monitoring in a delivery room. Option C, start antibiotics empirically. Option C, send for immediate brain MRI. Okay, so once we have done successful resuscitations, we have to continuously monitor. Option B is correct answer. We have to continuously monitor the baby. We have to intubate the baby, and then the baby has to be sent to the NICU, okay, neonatal intensive care unit, and continuously it has to be monitored until it is completely stable. Okay, until it is completely stable, we have to completely observe the baby, and we need to do a close observation and monitoring of the baby. So option B is the correct answer. So with this we have completed some of the important MCQs on neonatal resuscitation. I hope I have cleared some of the important concept regarding neonatal resuscitation. So thank you very much for patient listening. We'll see again in the next video. Thank you, take care, bye bye.